A strange pressure in your chest doesn't seem like much at first. Maybe it's something you ate, maybe you're just tired, maybe it will disappear in a few minutes. That's exactly what thousands of people tell themselves every single day. And for many of them, those few minutes become the difference between returning home with a healthy heart and living the rest of their lives with permanent damage. The truth is that heart attacks rarely look the way movies have taught us to expect. They don't always begin with a dramatic collapse or unbearable pain. More often, they arrive quietly, disguised as discomfort, fatigue, or indigestion. That misunderstanding causes dangerous delays, and every minute that passes allows more heart muscle to die. Understanding what is really happening inside your body and knowing exactly how to respond can dramatically improve your chances of recovery. By the end of this video, you'll understand not only what happens during a heart attack, but also the three simple actions that can make an enormous difference before medical professionals even reach you. One experienced cardiologist once explained it with a sentence that every person should remember for the rest of their life: your heart never waits for you. While you hesitate, the damage continues. Heart muscle doesn't pause while you decide whether your symptoms are serious enough to deserve attention. It simply keeps losing oxygen, and without oxygen, living tissue slowly begins to die. That loss cannot simply be reversed later. Modern medicine can reopen blocked arteries remarkably well, but it cannot restore heart muscle that has already been destroyed. That is why understanding these first moments matters far more than most people realize. To understand why these first few minutes are so important, it helps to picture how your heart actually works. Although it spends every second pumping blood throughout your body, the heart itself also needs a constant supply of oxygen-rich blood. It doesn't feed itself, using the blood flowing through its chambers. Instead, it depends on its own network of small blood vessels called the coronary arteries. These arteries wrap around the surface of the heart, delivering oxygen and nutrients to the hard-working muscle beneath them every moment of your life. Over many years, fatty deposits made up largely of cholesterol can slowly build inside these arteries. Most people never notice this process happening because it develops silently over decades. You can feel perfectly healthy while these deposits continue growing beneath the surface. Eventually, however, one of these fatty plaques may suddenly crack open. No one can predict the exact moment it will happen. It may occur during physical activity, emotional stress, or even while someone is quietly eating breakfast at home. When that plaque ruptures, your body reacts exactly as it was designed to. Your bloodstream interprets the crack as an injury. Tiny blood cells called platelets rush toward the damaged area and begin sticking together in an attempt to repair what appears to be a wound. Normally, this response protects you. It's what helps stop bleeding when you cut yourself. Inside a narrowed coronary artery, however, that same protective system becomes incredibly dangerous. As platelets continue gathering, they form a clot that can rapidly block blood flow through the artery. Once the vessel closes, everything downstream suddenly loses its oxygen supply. The heart muscle beyond that blockage immediately begins struggling to survive. It doesn't stop working right away. Instead, it desperately tries to continue pumping despite receiving less and less oxygen. That struggle is exactly why time becomes such a critical factor. Unlike many tissues in the body, heart muscle cannot tolerate long periods without oxygen. Every passing minute allows more cells to become permanently damaged. If blood flow is restored quickly enough, much of the threatened muscle can recover. If the blockage remains for too long, those living cells are replaced with scar tissue. Scar tissue cannot contract. It cannot help pump blood. It simply occupies space where healthy muscle once existed. That means even after someone survives a heart attack, their heart may never function as strongly as it did before. Everything that happens during those early moments revolves around three important questions. First, how quickly can doctors reopen the blocked artery? Second, can the growing clot be slowed while help is on the way? And third, can the heart's workload be reduced so the starving muscle isn't forced to consume even more oxygen before blood flow returns? These three ideas form the foundation of every emergency response. Understanding them makes every recommendation far easier to remember because each action serves a clear purpose instead of feeling like an arbitrary rule. To appreciate how much those early decisions matter, consider two people whose mornings began almost the same way. The first was a retired tradesman in his early 60s. He had always been independent, the type of person who solved his own problems and rarely asked anyone for assistance. One cool autumn morning, he came downstairs feeling unusually uncomfortable. There was a heavy sensation pressing across the center of his chest. His left arm ached. Sweat covered his forehead even though the room wasn't warm, and he felt slightly nauseated. His wife immediately noticed that something looked wrong. His skin appeared pale, and even holding his coffee cup seemed strangely difficult. She urged him to seek medical help immediately, but he brushed the symptoms aside. He convinced himself it was probably a stubborn cold or perhaps something he had eaten the night before. More than anything, he didn't want to overreact or create unnecessary worry. He decided he would simply wait a little longer and see whether the discomfort faded on its own. Unfortunately, those minutes stretched into hours. As time passed, the pressure became worse instead of better. Eventually, he could barely speak in complete sentences. His breathing became labored and his strength began disappearing. By the time he finally reached the hospital, precious hours had already been lost. Doctors were able to save his life, but they could not undo the extensive damage that had occurred while the blocked artery remained untreated. The consequences followed him long after he left the hospital. Everyday activities became exhausting. Climbing stairs left him breathless. Tasks that once felt effortless now required frequent breaks. Instead of returning to the active retirement he had imagined, he found himself adapting to permanent limitations caused not only by the heart attack itself, but by the delay in responding to it. Stories like his are unfortunately common, not because people ignore obvious danger, but because most heart attacks don't feel obvious at all. Many people expect overwhelming pain, dramatic collapse, or immediate loss of consciousness. When reality doesn't match that expectation, they search for less frightening explanations. They blame indigestion, muscle strain, stress, fatigue, or even anxiety. That natural instinct to rationalize symptoms becomes one of the greatest obstacles to receiving life-saving treatment quickly. And that's where the second story begins. Another man, similar in age, experienced nearly the same warning signs on an ordinary morning. At first glance, there was almost nothing to separate his experience from the first man's, yet one simple decision made within the first few minutes would completely change the outcome of his life. The second man was also enjoying what seemed like an ordinary morning when something suddenly felt different. It wasn't a sharp, unbearable pain. Instead, it was an uncomfortable pressure spreading slowly across the center of his chest. Within minutes, he noticed a dull ache climbing into his jaw and a cold sweat beginning to cover his forehead. At first, he tried to convince himself it was nothing serious. Like countless others, he wondered whether he had simply slept in an awkward position or eaten something that upset his stomach. For a brief moment, he considered waiting to see if the feeling would disappear. Fortunately, something interrupted that train of thought. Months earlier, he had learned that heart attacks rarely announce themselves dramatically. He remembered hearing that unusual pressure, unexplained shortness of breath, nausea, or pain spreading into the arms, neck, jaw, shoulders, or upper back could all point toward the same dangerous problem. More importantly, he remembered that every minute of delay meant more heart muscle could be permanently lost. Instead of waiting, he acted immediately. That simple decision illustrates one of the biggest misconceptions surrounding heart attacks. Most people expect overwhelming chest pain so intense that it leaves no doubt about what is happening. While some heart attacks certainly present that way, many do not. In reality, symptoms often begin gradually and quietly. People frequently describe them as pressure, heaviness, squeezing, fullness, or tightness rather than pain. Some compare it to having a heavy object resting on their chest. Others feel as though someone has wrapped a tight band around their ribs. The discomfort doesn't always stay in one place either. It may travel into one or both arms, extend into the neck or jaw, spread across the shoulders, or even settle between the shoulder blades. Some people experience pain high in the abdomen, making them believe they are suffering from indigestion or acid reflux instead of a heart problem. This confusion delays treatment far too often. Heart attacks also bring symptoms that many people never associate with the heart. A sudden cold sweat, unexplained nausea, dizziness, unusual fatigue, or difficulty catching your breath may appear before significant chest discomfort ever develops. Some people become overwhelmingly tired for no obvious reason. Others simply feel that something isn't right, but struggle to explain exactly what they are experiencing. That vague feeling should never be ignored, especially when several symptoms appear together. Women in particular often experience heart attacks differently from what many older medical descriptions suggest. While chest pressure can certainly occur, women are more likely to report pain in the jaw, neck, upper back, or shoulders. They may notice severe fatigue that seems completely out of proportion to their activity level, persistent nausea, shortness of breath, or dizziness. Because these symptoms don't always match the classic image portrayed in movies and television, many women delay seeking emergency care, believing the problem must be something less serious. People living with diabetes face another unique challenge. Years of elevated blood sugar can damage nerves throughout the body, including those responsible for transmitting pain signals from the heart. As a result, a person experiencing a heart attack may feel only mild discomfort or sometimes almost none at all. Instead, they may notice weakness, sweating, unusual tiredness, breathlessness, or simply a deep sense that something feels wrong. These so-called silent heart attacks are especially dangerous because they are easier to dismiss. The lesson is surprisingly simple. You don't have to diagnose yourself. You only have to recognize when your symptoms deserve immediate attention. If pressure, discomfort, shortness of breath, or unexplained symptoms affecting your chest or upper body persist for several minutes and don't quickly improve, it's far safer to assume your heart may be involved until trained medical professionals prove otherwise. Being cautious is never something to regret. Waiting often is. It's also important to understand the difference between two medical emergencies that people frequently confuse: a heart attack and cardiac arrest. Although they're related, they are not the same condition. A heart attack is primarily a circulation problem. Blood blood flow through one of the coronary arteries becomes blocked, preventing oxygen from reaching part of the heart muscle. During a heart attack, most people remain awake and able to communicate. They may feel frightened, uncomfortable, nauseated, or short of breath, but their heart is usually still pumping blood. Cardiac arrest is entirely different. It is an electrical failure inside the heart. Instead of beating in an organized rhythm, the heart suddenly stops pumping effectively. Blood flow to the brain and the rest of the body ceases almost immediately. A person experiencing cardiac arrest collapses, becomes unresponsive, and either stops breathing or gasps abnormally. Without immediate intervention, survival becomes unlikely within minutes. The reason this distinction matters is that a heart attack can trigger cardiac arrest if treatment is delayed. That's exactly why rapid action is so critical. Preventing further damage during those first few minutes greatly improves the chances of avoiding even more serious complications. The first and most important action is surprisingly straightforward, yet it remains the one people delay most often. The moment you suspect you could be having a heart attack, call emergency medical services immediately. Many people believe the primary purpose of calling an ambulance is transportation. In reality, transportation is only one small part of what emergency responders provide. The real advantage begins the instant trained paramedics arrive. Instead of waiting until you reach the hospital, medical evaluation starts wherever you are. Emergency crews can quickly attach monitors that record your heart's electrical activity, measure vital signs, provide oxygen when necessary, establish intravenous access, administer appropriate medications, and communicate directly with the receiving hospital before you ever leave your driveway. This early communication saves valuable time if the heart tracing shows evidence of a major artery blockage. The hospital's cardiac team can begin preparing before you arrive. Specialists are alerted. Equipment is readied. The catheterization laboratory can be assembled while you're still in the ambulance. Instead of starting the evaluation after reaching the emergency department, treatment begins long before you arrive. Every minute saved increases the likelihood that blood flow can be restored before large amounts of heart muscle are permanently damaged. Yet despite these advantages, many people hesitate. Some don't want to inconvenience emergency responders. Others worry about being embarrassed if their symptoms turn out to be something less serious. Some fear creating unnecessary panic for their family. These thoughts are understandable, but they're exactly the kind of hesitation that costs valuable time. Emergency medical professionals would far rather evaluate someone whose symptoms prove harmless than arrive hours later after preventable damage has already occurred. Responding to uncertain situations is part of their job. They expect it, and they would never consider an early call an inconvenience. Another common mistake is deciding to drive yourself to the hospital or asking a family member to drive you instead of calling emergency services. Although it may seem faster, it introduces unnecessary risk. Heart rhythms can suddenly become unstable during a heart attack. If that happens while you're driving, you could lose consciousness without warning, placing yourself, your passengers, and everyone else on the road in danger. Inside an ambulance, however, trained professionals are monitoring your condition continuously. If your heart rhythm changes or you develop life-threatening complications,